Good evening, everybody. We're going to get started. My name is Ricky Wong. I am the Assistant Commissioner for Government Affairs here at the New York City Department of Health and Mental Hygiene. It's my pleasure. I'm going to introduce our panel for this evening. First, we have Dr. Andrea Howard. She's the Deputy Commissioner for Disease Control. Then we have Corinne Schiff, who is the Deputy Commissioner for Environmental Health. And then we have Dr. Celia Quinn, who's the Senior Advisor to the Commissioner. And of course, we have your Commissioner of Health, Dr. Alistair Martin. And I'll turn it over now to Dr. Martin.
Thank you very much, Ricky. And thank you everyone for joining us again tonight. Our plan for tonight is going to be to give you an updated sense of where we are now in our investigation into the cluster of Legionnaires' disease in the Upper East Side. Before we get there, we're going to start with some basic information on Legionnaires' disease and some of the frequently asked questions that we're hearing from folks that are top of mind in the community. So before we get into that, I'm going to turn it over to Dr. Howard to get us started with some high-level information on Legionnaires. Over to you, Dr. Howard.
Great, thank you, Commissioner. Next slide, please. And next slide, please. Okay, so what is Legionnaire's disease? Legionnaire's disease is a type of pneumonia. It is caused by bacteria called Legionella that grow in warm water. Legionnaire's disease can cause flu-like symptoms, and complications from the disease can be fatal. Symptoms of Legionnaire's disease include fever, chills, muscle aches, and a cough. You may also have headaches, fatigue, loss of appetite, confusion, or diarrhea. Anyone experiencing any of these symptoms should seek medical attention right away. People especially at risk for Legionnaire's disease are people who smoke or vape, and those who have a medical condition that affects their breathing. Next slide, please. It's important to know that most exposed people do not develop Legionnaire's disease. Those at highest risk of developing disease are people over the age of 50, people who smoke or vape, and those who have underlying health conditions such as lung disease, diabetes, or a suppressed immune system. Legionnaire's disease is extremely rare in babies and in children, and it is never seen in pets. Next slide, and over to Corinne Schiff.
Thank you, Dr. Howard. Good evening, everybody. So how do you get Legionnaire's disease? People can get Legionnaire's disease by breathing in water vapor in the air that contains the bacteria from sources such as cooling towers. That's the only way to get it, is breathing in water vapor with Legionella bacteria. The likely source of the Legionella bacteria is cooling towers on the Upper East Side in this investigation that we are doing. Cooling towers are usually found on the tops of buildings, and they're responsible for regulating the temperature of cooling systems such as air conditioning or refrigeration. And we have this photo up there to distinguish a cooling tower you can see in that green circle, and it is not a drinking water tank, which is that wooden round structure with the X through it. Cooling towers emit water vapor into the air like a car exhaust emits carbon dioxide. Next slide. You cannot get Legionnaire's disease from someone else who's sick with Legionnaire's disease. It's not contagious. You do not get Legionnaire's disease from drinking water, and you can use your air conditioner. Next slide. We want to talk about two different kinds of investigations that we do at the health department, depending on the pattern of cases we see of Legionnaire's disease. As Dr. Howard said, Legionnaire's disease is very rare, and the cases are reported to us. And our case investigators are specialists in Legionnaire's disease, and they are monitoring those cases, looking for patterns. Most of the time, there's a case here and a case there, and we don't know what the source of exposure might be. But when there's a pattern, it suggests to us that the bacteria might be growing in the built environment, and that means that we can look for it and cut off the source of exposure. And there are different kinds of patterns that we see. When we see a pattern of cases in the same building, the same address where people share a hot water system, and there are cases that might happen over a 12-month period, that leads us to think it could be growing in the building's internal plumbing system, and we call that a building investigation or a building evaluation. That's not what we have here. The pattern that we see here is a different kind of pattern that we also see, which is cases in a tighter time frame in a neighborhood. That's what's happened on the Upper East Side. That is called a community cluster, and that's what we think when we think that's probably coming from a cooling tower. So that's why we are investigating the cooling towers. Next slide. Now I'll turn it over to Dr. Celia Quinn for some of the frequently asked questions.
Thanks, Corinne. Appreciate everyone being here. So this is a few of the kinds of questions we've been getting throughout this cluster. So one question is about wearing a mask. The health department doesn't recommend wearing a mask to prevent Legionnaire's disease. There's no evidence that using a mask would be effective at preventing Legionnaire's disease in this situation. Most people who are exposed to the Legionella bacteria don't develop illness, but for those that do, if they get appropriate treatment right away, they'll have much better outcomes. So the best thing to do is to see a healthcare provider right away if you have experienced symptoms that are like Legionnaire's disease, like Dr. Howard described, and were in the neighborhood that we are talking about within the past few weeks. We also get a lot of questions about getting tested for Legionnaire's disease. There's no screening test for Legionnaire's disease, so if you've been exposed, there's not a test to do to know if you may become ill in a few days or weeks. If you do have symptoms of Legionnaire's disease, a healthcare provider can diagnose Legionnaire's disease based on a series of tests. Because Legionnaire's disease is a form of pneumonia, people that have it can feel pretty sick, but there are other forms of pneumonia that can make people pretty sick. That's why it's important to see a healthcare provider and get a full workup to make sure that people get the right kind of treatment for the illness that they have. Again, most people who are exposed to Legionella bacteria don't become sick. And so to get a test for Legionella when you're not sick, you wouldn't be diagnosed with Legionnaire's disease. We're going to talk more about this third question later in this presentation, but this is the question about whether it's safe to be in a building that tested PCR positive. So the risk of contracting Legionnaire's disease from the air inside a building that has a cooling tower that tested PCR positive is not different from elsewhere in the neighborhood. The main message that we want people to take away is that if they develop symptoms of Legionnaire's disease and were in any of the 3 zip codes within the few weeks before they became ill, to get evaluated. Because of the incubation period of Legionnaire's disease, we expect that people could still develop symptoms for up to 10 to 14 days after the source of the Legionella bacteria was eliminated. I did want to pause here and just make a few more comments about the testing that is done for the cooling tower systems. And I know we're going to talk more about this in this presentation as well. So when we do an investigation for a community cluster, the way Corinne described, we have our water ecologists take samples from the cooling tower systems. They bring the samples to our public health laboratory. The lab does an initial screening for the bacteria that causes Legionnaire's disease. And that screening test is a PCR or molecular test that can detect the presence of very small amounts of genetic material of that bacteria. It does not distinguish between whether the bacteria is alive or dead, and it's only alive bacteria that can cause harm for human health or cause an infection of Legionnaire's disease. So although the PCR results, the screening test results, don't confirm that the bacteria are able to cause disease, the health department still acts on those results right away by ordering the cooling tower operators to remediate. regardless of whether the samples screen positive or negative with a PCR test, we test them for a culture to grow a Legionella culture. So that's where the lab tries to grow the Legionella bacteria in the lab. And if the lab is able to grow the Legionella bacteria culture, then we have evidence that that cooling tower system was growing live Legionella that has the possibility of making people sick. But those results take a couple of weeks to come back once we have them in the laboratory. Even later, if we have a Legionella culture specimen from a patient, the lab can do whole genome sequencing to make a direct match between any of the cooling towers that had positive cultures and the patients that are associated with this outbreak. And that's how we would identify a particular tower as the source. And I know that's a lot of information. I'm probably talking way too much, but we will be reviewing some of these details later in this presentation as well. Just to circle back to what the actual question was, there's no difference in the risk of getting Legionnaire's disease from being in or near a building that tested PCR positive versus the rest of the zip codes. Next slide. Okay, are babies or children at risk? I love this question because I'm a pediatrician and also a mom, and I'm happy to tell you that Legionnaire's disease is extremely rare in children and babies, and we don't have any pediatric cases as part of this cluster. Have also heard that the concern about whether pregnant people are at risk. So people who are pregnant are not at increased risk for Legionnaire's disease because of their pregnancy, but someone who is pregnant and has another risk factor like a smoking history or lung disease may be at slightly increased risk. And I think a lot of questions come around, is Legionnaire's disease preventable? So there's no vaccine for Legionnaire's disease. It can't be prevented with a vaccine. It can be treated effectively with antibiotics, especially early in the course of illness. So again, that's why we're emphasizing the need to seek healthcare if you have symptoms that are like flu-like symptoms, fever, cough, not feeling well, and have lived, worked, or visited within those 3 zip codes, 10128, 10028, and 10075 in the couple of weeks before you came ill. And the best way to prevent Legionnaire's disease community clusters is for building owners to properly maintain the cooling towers where Legionella may grow, as Corinne described. So let me turn it back over to Dr. Martin.
Thank you very much, Dr. Quinn. So we want to now give you a little bit more information in terms of our investigation and go in a little bit more depth in terms of the information that we have and where this investigation is heading. But before we do that, I want to give you a high-level overview of the case count, which we have at present, confirmed at 59 confirmed cases of Legionnaire's disease. As you can see here, looking through the rest, currently hospitalized, we have 15 that we are tracking. 33 patients have been discharged and 11 have never been hospitalized. This is information that we have on our website that's published every single day, and we keep this updated. And for those of you who are looking at this site, what you'll notice is that about half, just over half of the individuals who were hospitalized for Legionnaire's disease as part of this cluster have made it fully all the way through the process and have been discharged. That's that number that you see there at 33. You can go on to the next slide. All right, now let's talk epi curve. What the epi curve here is showing you is right on the x-axis, the horizontal axis. It gives you a sense of the day a diagnosis was made of Legionnaire's disease. On the y-axis, right, that vertical axis, it shows you how many people were newly diagnosed with Legionnaire's disease. So what you can see and what you can interpret from this epi curve is a large number of newly diagnosed cases between the band between July 1st into July 8th. And then you begin to see fewer cases going on from there. 7-10 and 7-11 with no cases, and then 7-12 with 1. Now, to give you a sense of how we think about this, right? The incubation period for Legionnaire's disease is between 2 and 10 days, sometimes as long as 14 days. But what we really start to see, right, myself, I'm an ER doctor, and what I've noticed is that when patients start really developing symptoms is right around day 5, day 6 after the exposure. And so the diagnosis date gives us a sense that there was an environmental exposure, likely a few weeks earlier, right? Most likely sometime between 10 to 14 days. And so the bottom line is we expect to start seeing new diagnoses stop by 10 to 14 days after the Legionella exposure was remedied, or 10 to 14 days after the offending cooling tower had its Legionella removed through drainage, cleaning, and disinfecting of that cooling tower. You can go to the next slide. Now let's talk about those cooling towers. As part of this investigation, we sampled a total of 183 cooling towers. To put this into context for folks, when we think about the last cluster that we had in Harlem in 2025, that was about 40 to 50, so about 47 cooling towers total. This is orders of magnitude more cooling towers which are involved this time. Out of the 183 which we sampled, 31 of them came back as PCR positive results. Every single one of those 31 have drained, cleaned, and disinfected their cooling towers, which is what we need to see the resolution of this cluster, right? This idea that really what's making people sick is being exposed to Legionella bacteria, and this type of response that we've gotten from landlords, cooling tower operators, is exactly what we need to resolve this cluster. Every single one of those 31 buildings, we as the health department have confirmed that they've cleaned, they've disinfected their cooling towers. There are additional buildings that we've ordered to remediate their towers, and that happened over the weekend, and we're going to be releasing that information very, very, very soon. But just to highlight this, right? The moment a tower's PCR positive result came back, that tower was ordered to remediate. We did not wait, nor will we wait, for confirmatory testing, which could take weeks for the bacterial culture. We don't have time for weeks. As soon as we understand whether or not a tower even has the hint of a positive signal for potentially having Legionella bacteria, that is our cue to get that cooling tower operator to clean, drain, and disinfect that cooling tower immediately. We can go to the next slide. Now, we've published a list of all of those addresses which have had a PCR positive result. That link is on the screen. We published this on Friday. I do want to say just a quick word about this, though, because we're gonna get a little bit deep, a little bit nerdy in terms of the testing in a second. So let me just give you a very high-level overview. The PCR positive building result does not necessarily mean that that cooling tower has active live bacteria in it, right? The PCR positive simply tells us whether or not there's the presence of Legionella DNA. Could be old, dead Legionella bacteria, could be live Legionella bacteria. And it's only the live Legionella bacteria that gets people sick. And so we thought it was important to take the most aggressive posture we've ever taken, which is to say, ordering the cleaning, the draining, and the disinfecting of any and every PCR positive cooling tower, and not to wait for the bacterial culture result, understanding that many of those towers, which were PCR positive, may not actually have live bacteria. Let's go to the next slide. All right, now let's talk about these tests. The PCR positive is what I've been talking about for the last minute or so. That takes about 24 to 48 hours and really only gives us a sense of whether or not there's Legionella bacteria DNA, but it really can't distinguish live or dead. We need the bacterial culture for that. But there's a problem. The bacterial culture takes 2 weeks. And that confirmatory result is absolutely helpful for us. But in this case, we did not wait for those 2 weeks. We decided to activate the commissioner's orders to get every single one of those cooling towers to be cleaned that needed to in that 24 to 48 hour window when the PCR positive result comes back. Here's the thing to know about the bacterial culture. Now, it will tell us if there's evidence of bacteria in that cooling tower, Legionella bacteria. But it's not necessarily telling us that it is the source of this cluster. What do I mean by that? The only way that we can link the source of this cluster, meaning the one or very small number of cooling towers, perhaps, typically it's only one, that it's causing this cluster, the only way that we can identify and make that match happen is by this third step that you see here, DNA sequencing. Here's what we do. We take the sputum of a patient who's sick with Legionella, with Legionnaire's disease, and we do whole genome sequencing. We actually sequence the entire DNA. We then go back to that cooling tower result, the one that grew out live bacterial culture, and we do the same thing there. And we sequence that whole genome. And then we put them together. And sometimes we're able to identify an exact match, and that will tell us the one, often again, most times it's one cooling tower that caused this cluster. Sometimes we never find that one cooling tower. And so I think we talked about this, both the virtual town hall and also the in-person town hall last week. But this last step is challenging, right? The idea is docs and nurses and nurse practitioners, clinicians are busy. And so to ask them to do an extra step of getting a sputum culture is not always a given or a guarantee. In fact, myself, I've sent dozens of urine antigen tests for Legionella, but I haven't really sent many sputum tests because this is an extra step that often patients find uncomfortable. And so we are hoping to obtain that, but if we don't, we may not be able to ever identify the one source, but we're avidly working on that and trying to make sure that we use the information that we can to help guide this investigation. We can go to the next slide. All right, I want to leave you just a couple of bullets in terms of the review of some of the key health department actions as part of this investigation, which again started back in July 2nd. We've sampled and tested the water from all 180 cooling towers in the area of this cluster. We've ordered all building owners with a positive PCR to drain, clean, and disinfect that cooling tower immediately, even though some of those, and I will say probably the majority, don't have any live bacteria in them, right? But that aggressive posture and not waiting for the bacterial culture result, we thought was incredibly important to do to take this potential offending bacteria off the map. Next, we released building addresses that received commissioner's directives to remediate, and we have another tranche that will be released very, very, very soon. Next, we're conducting inspections of all PCR positive cooling towers, regardless of their last inspection that's currently happening. And then we're continuing to culture test all of those PCR positive cooling towers to see which of them truly have evidence of live bacteria in them. And we'll continue to update our website with confirmatory test results as they come in. Let me pause there and kick it back to Ricky.
Thank you, Commissioner Martin, and also to the panelists. Before we move on to question and answers, we have Council's Speaker Julie Menon with us, who wanted to give some brief remarks. So I'm going to ask the Council Speaker to go ahead and speak.
Hi, thank you, Ricky. Hopefully for some reason, the screen is not coming on. I'm not sure if you're able to change that and make me a panelist.
Well, I think we have to work through that, but we can
Okay,
hear you.
that's
So
okay.
please
As
go
long
ahead.
as everyone can hear me. Hi, everyone. Well, first of all, Commissioner, I want to thank you. I want to thank your team for doing another updated town hall. These town halls are very important so that the community can be able to ask the questions. I have a number of questions and just statements I wanted to briefly state, which is, my concern, as I have said to you and your team, is I am concerned that by waiting for the PCR test to come back, that we lose that valuable time. So, and I still don't understand why the health department is not immediately disordering through the commissioner's orders a disinfecting of towers where you don't yet have the PCR test back. So my first question is, how many of the 183 towers do not have a test result back? Are you still waiting for the test result?
Oh, Madam Speaker, do you have any other additional comments
Yeah,
before
I
we move on?
do. I do. I have, and then my other comment is, again, I understand the health department knows where the epicenter is. And as I said last week at the town hall, I really urge you to disclose where the epicenter is so that the public can know that. And then third, I know you released the 31 buildings, as you mentioned, on Friday, but moving forward, it's in the public interest that as soon as you have a positive test, to immediately release the address of the building so the community can know that. And then my fourth and final point is I am really concerned still that there's no preventative guidance. I understand you're not advising people to wear masks, but I'm hearing from a lot of constituents who are seniors or who are immunocompromised. And the question they have is, should they limit their time outside? There have to be some reasonable precautionary steps that you can recommend that people take. And that I'm getting that question again and again, and I'm really urging the health department to offer some kind of proactive preventative guidance.
Okay, thank you, Madam Speaker. We're going to move on to the Q&A section. I appreciate you. Just a moment here as we kind of go through the questions. First question is, how did this happen? And are they not required inspections? Thank you.
Corinne, wanted to
You want me to take that? Yeah, sure. So this New York City has among the most protective and rigorous cooling tower laws and regulations in the country and really in the world. And cooling tower operators are required to maintain their cooling towers in accordance with those laws and regulations. We don't know yet whether there were cooling tower operators who were not in compliance with the laws and regulations. Our first step in addressing this cluster was to get out very, very quickly to all of the cooling towers in the affected area. So that's what we've been focused on. Dr. Martin went over those very high numbers. We are now turning our attention to inspections to try to get at the very same question that you have. We have that question. And that is what our inspections will hope to uncover.
Okay, the next question. Yes or no from showers in affected buildings? A lot of conflicting info about that.
So in the scenario of a community cluster, which we are in now, it is safe to use your shower, safe to use your air conditioner, safe to drink your water. And so for this cluster investigation, all of those uses remain completely safe.
Next question is a building that's one of the ones with the infected towers tells me cleaning was completed several days ago. But we just wanted to confirm if that's actually the case, and do we have to, as a health department, approve the cleaning before it's confirmed as clean?
So we issue a very detailed order to clean and disinfect to the building where there is a PCR positive result for that cooling tower. We then require a confirmation of that cleaning and disinfection. So that is our oversight of them, and it could be a building. As we will release more information, if your owner is telling you that they have conducted the cleaning and disinfection, as Commissioner Martin said, we are getting very, very good cooperation from our building owners in the affected area, and we really appreciate that.
So the next question is, I requested a Legionella urinary antigen test at an urgent care. They said that they weren't accepting that test, so I got a PCR instead with a 3 to 4 day turnaround. Is this a citywide lab capacity issue? And what should residents do if the faster urinary antigen test isn't available?
I can start things off here and then maybe kick it to either doctors Howard or Quinn. If you are having trouble getting seen or getting evaluated, in this case, we recommend calling or texting 311, and we can help to get you routed through to a provider who can get you access to the appropriate testing that you need to get evaluated in this case.
Yeah, and I'll just jump in and add that urine antigen test is a very commonly used test to determine if someone who has pneumonia also has evidence of being infected with the Legionella bacteria. But it's the interpretation of that test is difficult if the person doesn't have pneumonia. So we really are not recommending any testing for people who are not sick. If people are sick, they need to get evaluated by a clinician, as the commissioner just described.
Next question. With the upcoming heat wave this week, will you be retesting, and what are you doing to prevent a new outbreak?
Yeah, I think I can maybe kick this off and then send it to you, Deputy Commissioner Schiff. So, first of all, the heat is something that we worry about. Why? Because ultimately, the Legionella bacteria likes warm water, right? And standing pools of warm water are a perfect place for that bacteria to replicate. And so our general guidance is it's going to be hot Tuesday and Wednesday. And it's important for folks to continue to use things like their AC or their central AC or that window unit, because while this is an important and urgent challenge to make sure that folks who are having symptoms like cough, fever, shortness of breath are contacting their providers, it's also going to be very important in the coming days to stay cool. And what we know from our data, recently published data, is that being able to stay safe during coming days, like the ones we will experience, often depends on whether or not an individual has access to a functioning air conditioner. So we think it's very, very important for folks to know that information and to know that it is safe to continue using your AC. Deputy Commissioner Schiff.
Go ahead.
Thank you, Commissioner. I will just add, first, as the commissioner said, when it is very hot, we worry about heat-related illness. We want you to use your air conditioner to keep your home at a safe temperature. Check on your friends and neighbors. Make sure they're using an air conditioner. If they don't have an air conditioner, seek out a cool place. In terms of the cooling towers, you will now have a set of extremely clean cooling towers in your community. A cooling tower operator is required to maintain it really every day. Whether it's very hot or some of these cooling towers run all year round. So I think the things to keep in mind are pay attention to the heat. It can be dangerous. Run your air conditioner. And we will be doing ongoing inspections, as I noted, to see where we are seeing compliance fall short, and we will be doing enforcement of where there is poor compliance.
So piggybacking off that question about the heat, is the health department looking at either sprinklers or fountains in the affected areas? Are they being tested too?
So the sprinklers in the playgrounds, we urge you to seek out and have a good time using those sprinklers as a way to have fun and play with the children. Fountains can be a source of Legionnaire's disease, depending on the details, but the sprinklers come from our potable water source and do not have the profile where we are concerned about risk. So please, in that heat, playing in a sprinkler is a great way to stay cool and have fun.
Are we looking at other cooling towers in adjoining zip codes, not in the 3 specific zip codes?
Can kick this one off here and then pass it over to Deputy Commissioner Schiff. First of all, a question was asked, where are we in the testing and sampling as part of this investigation? So we are happy to say that 100% of all of the cooling towers which are in this zone, these 3 zip codes, 100% of those that we are concerned about, we've sampled. And again, to give folks a sense of where we are compared to previous clusters that we've had to engage with, this is by far the largest and multiple times larger than Harlem last year. I'm going to kick it to Deputy Commissioner Schiff to talk about the zip codes. Turn it over to her.
Our inspectional work is citywide. Of course, the city's laws and regulations apply to the cooling towers throughout the city, but our cluster investigation is with respect to the cooling towers that Dr. Martin has described, and we have completed that sampling.
Okay, so the next question is, I heard a lot of questions about taking a urine antigen test, but is there an actual test that can be taken to determine if you've been exposed? I heard something about a blood test.
You want to take that one, Dr. Quinn, Dr. Howard?
Yeah, so there's no test to know if someone was exposed. That's why we're encouraging anyone that lives, works, or visited any of those 3 zip codes to pay attention to their symptoms and seek medical care and get a full evaluation if they start to feel sick.
Regarding the list of the 31 buildings, is that unusually high to see that many PCR positives come back?
So the comments that I made towards the middle of this town hall were meant to give you a sense of scale in terms of our testing apparatus, right? Because we have chosen to be more aggressive than we've ever been before when it comes to a cluster, there's going to be a lot more buildings on that list, right? The PCR positive step identifies a much broader universe of potential cooling towers. Again, being on that list does not mean that there absolutely is live Legionella bacteria in that cooling tower. It means that there's DNA evidence of Legionella bacteria. Could be dead, could be live. And so we expected to have a larger list because we are doing a test which is bringing in more potential cooling towers that we are ordering to remediate. And that's part of the give and take here. In the past, we released the results of the names of cooling towers that were bacterial positive culture, meaning we waited the 2 weeks and we got evidence of which cooling towers were actually growing bacteria out. This time around, we decided we were not going to wait 2 weeks. We wanted to move quickly and release the names of those who are in the PCR positive category. And so that's why the list is longer than it normally would be. Again, it's a trade-off, knowing that many of those towers likely won't have live Legionella bacteria.
Okay, so my building cleaned their cooling tower this past week after a positive PCR test, and also again they cleaned it again today based on a commissioner's order. Is that actually possible that they have done cleaning twice? And why would this be?
It's very hard for me to answer this question without knowing the details. I will say that we have, as you are hearing, we have ordered the buildings with PCR positive tests to fully clean and disinfect, even though we don't know whether that bacteria can cause disease. It may be dead. But exactly what you've described here, I just don't know enough to answer.
Okay. Next question is, if someone had symptoms for a day or two last week, just a cough, maybe some fatigue, but those symptoms went away after a couple of days, I would imagine that I may not be considered symptomatic and possibly do not need to be tested. I just wanted to ask.
For individuals in the affected zip code, right, the zip codes 10128, 10028, and 10075, those three, our recommendation is if you have those kinds of symptoms, cough, fever, shortness of breath, to contact your provider and get evaluated. I think in this case, it's better to have a lower threshold, right, to get evaluated and to see a doc to really sit with you, take a history, do an exam, and then decide on whether or not testing is warranted. But it's a great question.
I would like for Dr. Quinn to please discuss either wearing or not wearing of masks for protection again.
Sure. So the health department doesn't have a recommendation about masks in this situation. We don't have evidence that a mask would be protective, so we don't know what kind of mask we would recommend or how to wear it, when to wear it to be protective. Again, many people would have been exposed. All of the people in these 3 zip codes could have been exposed, and so we're really emphasizing that people who may have been exposed should monitor for symptoms and seek treatment so that they can get appropriate therapy right away. The cases that we're diagnosing today or yesterday could have had exposures 10 to 14 days ago before we even knew that this outbreak was happening. That's why we're really emphasizing the message about seeking medical care if you have symptoms that might be Legionnaire's disease.
In the chart posted on the New York City website this morning, the number of new cases in the last few days seem to have decreased. Does this mean that the problem in general seems to be ending, or could it be just an issue with reporting over the weekend?
Thank you for that question. So the data is updated every single day. This is not an issue with recording any of that data. Look, from our standpoint, we are still in the midst of this investigation and still are ordering cooling tower operators and landlords to do the work that's necessary to resolve this, which again is draining, cleaning, and disinfecting that cooling tower, right? At the end of the day, what is driving this is the fact that sometime in the past there was a cooling tower, potentially still is out there, that has Legionella bacteria in it, which is causing people to get sick. The more cooling towers we identify and order the remediation of, the lower the risk of continued spread. And so our hope and our current expectation is that if cooling tower owners and landlords comply, which they have so far, which we're grateful for, we will see the resolution of this cluster.
Yeah, and can I just jump in and add, because Commissioner Martin showed the epi curve to everyone, and we look at the diagnosis days, and that tells us about some exposure that may have happened 10 to 14 days ago. So that is exactly the kind of thing that we're looking for as we get to a period of time in the next few days into the end of this week where it will have been, in the range of 10 to 14 days since we started ordering the cleaning and disinfection. That's when we would hope that we would start to see the new cases start to decline. That said, we won't know until we're through it and we're looking backward at it. So for people who have lived in, been in, worked in those neighborhoods, it's still important to seek care if you may have symptoms of Legionella.
This next question is in reference to the photo that we showed in the slide set about the cooling tower right next to a water tank. If a cooling tower is contaminated with Legionella, can it spread to the water tank?
I love talking about drinking water tanks. Those are the wooden round structures that New York City is so famous for. They are these simple, elegant drinking water delivery devices that are not at risk for Legionella bacteria for a couple of reasons. The water is generally cool, it is in constant motion, and there is a chlorine residual, a tiny bit of chlorine. And so we have not seen Legionnaires disease clusters associated with a drinking water tank. And I would just, all my colleagues will tease me because they know every time I have a chance to talk about New York City drinking water, I love to do it. We have delicious drinking water. It's the best beverage for your health, I like to say. So you should feel confident drinking your tap water.
Next question is, if cleaning of the cooling towers is being done right after a positive PCR test and not waiting for the culture, does that mean that even if the culture test result is positive, nothing really additional is needed because it has already been cleaned?
It's a great question. I'll start us off and then I'm going to kick it to Deputy Commissioner Schiff. Again, the way to resolve this cluster is to clean, drain, and disinfect any and every cooling tower that could potentially be the source of this cluster. And by moving the dial over to the PCR positive result, we're doing that action, ordering those cleaning, the disinfection, and the drainage a lot earlier. If one of those towers then comes back as positive, remember the sample that we're testing is the sample that was taken before the cleaning, draining, and disinfecting. So in essence, the bacterial culture result is looking at the past. And in the present, again, for the 100% of towers that we've named already, they have done all of the necessary cleaning, draining, and disinfection. So those 31 towers, we can confirm have followed through and done what we needed them to do to remove the possible threat. Let me kick it to Deputy Commissioner Schiff for more.
Yes, absolutely. The only thing I would add is so the work under our commissioner's order will have been completed. So even if that result comes back culture positive, there's no additional order that the building will get from us to do further work. But If you have a cooling tower, you have to maintain it all the time. So we continue to expect that our cooling tower operators maintain their cooling towers in accordance with New York City's most protective laws and regulations all the time. And we continue to do outreach and education and inspections and enforcement to promote that compliance.
And let me get a little nerdier, because some folks might ask also, and I heard this at the in-person town hall last week. Well, Doc, if you've ordered the cooling towers to do the remediation again, draining, cleaning, disinfecting, you've done that, why don't you just throw out the cultures? Why don't you just toss the samples? We don't need to do anything else. So why not just get rid of the samples? What more information do we get from that? Here's the information that we get. That sample, again, which was taken in the past, will allow us to potentially grow out Legionella bacteria from that water. And then the bacteria that grows out, we can then sequence its DNA and check it against the potential DNA of the Legionella bacteria that's causing Legionnaires' disease in our patients out there. Again, it's hard to get that sputum sample, but sometimes we get lucky. And so there is still value in identifying if there's a positive match between those two things, right? Because remember, there's two things that we're trying to do here. Thing number one is, right, remove the offending agent. And we're doing that by ordering the cooling tower operators and the landlords to do this cleaning, the draining, and disinfecting. The second thing that we're avidly trying to do here as well is identify if we can find the source, right? The singular source. And why is that? That's because there's an opportunity for us to learn, right? What happened? How did we get here? Was this a lapse on the part of the cooling tower operator? Is there an opportunity to learn something about what needed to be done differently by the landlord? And so there are both of these tracks that are running at the same time. But again, the way out of this, the way to resolve this is to remove the bacteria from these cooling towers.
Okay, so as a person, is testing confirmed by symptoms or by infection with the Legionella bacteria?
Yeah, I can take that one. So to be diagnosed with Legionnaire's disease, you have to have pneumonia, which needs to be diagnosed by a clinician, usually with evidence of like a chest x-ray that shows evidence of pneumonia. And you have to have laboratory evidence that that infection was caused by the Legionella bacteria. So both things are necessary to make a diagnosis of Legionnaire's disease.
Next question is, if I had all the symptoms right before this cluster was publicized, and I've kind of gotten better on my own, but I still have a lingering cough, should I do anything?
It's a great question. The perspective that we have here at the health department is if you are in those 3 zip codes, even if you had symptoms the day before that, we announced this investigation. So we announced the investigation on July 2nd. If you had symptoms on July 1st, it's absolutely important for you to get evaluated by a doctor, particularly because this is the type of disease which is absolutely treatable. And while you might feel okay today, those symptoms of cough, fever, flu-like symptoms, they could be signs of Legionnaire's disease. And so I think it's important for folks to not blow these symptoms off.
A lot of buildings in our district have roof decks. Do you recommend avoiding them?
You want to take that one? We don't recommend avoiding roof decks. This is typically transmitted by cooling towers, which are emanating mist. It's then floating down, which people are inhaling. So one of the things that we get that's related to this question is a question of, well, if that building across the street has been named on this list, can I go in that building safely? The answer is yes, you can go in that building safely. Importantly, because the cooling tower, which was named on that list, we've confirmed they've gone through and done the necessary steps to remediate that cooling tower. And so those are some of the questions that we're hearing frequently about folks in the neighborhood.
This is going to be the last question for this virtual town hall. I want to better understand how the bacteria is released from cooling tower infects somebody. Does it kind of trickle down from the rooftop to street level? Is it kind of blowing around, going a few blocks away, and somebody just walking around and breathes it in? Just very concerned about people either being on the street a few blocks away or just like right by the building.
Let me kick this one off. Yeah, so what's happening is that the water that's in that cooling tower is essentially serving as a perfect breeding ground for the Legionella bacteria. And what ends up happening is the mist that's emanating from the top of that cooling tower, those droplets are what's harboring the bacteria, and that's what people are then inhaling. And so yes, it's the mist coming down that people are interacting with, that are being exposed to. And again, the highest risk groups that we worry about are folks who are seniors, folks who smoke, and individuals who have chronic comorbidities or who have conditions that lower their immune system or that require them to take immunosuppressants.
Yeah, and sorry, Ricky, one other point on that one is just that, Legionella is in the environment. It's in the environment all over the place, not just in the Upper East Side. The reason we're doing this investigation is because we have epidemiologic signals that indicate that there's a source that could be stopped. So we could prevent some of the cases that are associated with that source. But New York City has like hundreds of cases of Legionnaire's disease every year, almost all of which are not tied to any particular source. So many people will be exposed. Only a very small number of people are going to become ill. And so, I'm hearing a lot of questions around like, is this part of the zip code more dangerous than that part of the zip code? Is this building more dangerous than that building? And the reality is that all three zip codes have much more likelihood of exposure to Legionella during the past several weeks compared to the rest of the city. So that's why we want everyone who was in those three zip codes to consider themselves having been exposed, regardless of where you were within those three zip codes.
Okay, so that concludes our virtual town hall for this evening. I would like to thank the panel for being here. I also would like to thank everyone for joining us. You can find a recording of this virtual town hall on our website. It should be uploaded by tomorrow. And please continue to visit our website for the most up-to-date information on this investigation. Thank you and good evening.